So, are you required to have Medicare? Last night at my workshop, Barbara asked this question, and it's a really good one. And the reality is, there's so much bad information about do you actually have to have Medicare, whether it be from different documents or even from your friends who have opinions. And so, in this video, I want to get really clear on do you really have to have Medicare? And in what situations can you not have Medicare and not be penalized? You've worked hard for Medicare. Let's now get the most out of it. Again, I'm Emily with the Medicare Coach, the leading independent Medicare advocate, helping you easily make your right Medicare decision. I really discovered Medicare a few years ago when I was helping my dad easily make his right Medicare decision, and since then have become the leading advocate across the country, helping you navigate Medicare to both protect your healthcare rights as well as your hard-earned retirement savings. Make sure that you click the button below to subscribe and follow more for my channel. So when Barbara asked whether or not she has to have Medicare, it's a really good question, okay? And again, there's a lot of conflicting information out there, and I feel like Medicare doesn't do a great job of actually educating you properly as to how the rules work. So let's get really clear on what Medicare rules say when it comes to the requirements to having Medicare. Medicare rules say by the time you're 65, you either have to be on Medicare or on an employer plan that meets Medicare rules. Now, there are a few different requirements in order for Medicare to meet Medicare rules, which I covered in other videos in more detail. But the three most important ones are that number one, you have to have an employer health insurance plan. Number two, that employer has to have 20 employees or more. And number three, that plan must have creditable drug coverage, okay? Again, check out my other video for more information on that, but those are the three main requirements. So what that means is this. In Barbara's case, she is working past 65 and she has an employer plan that meets all of these rules. And for that reason, she's not required to have Medicare at 65 and she will not be penalized for doing so, okay? So again, having an employer plan that meets Medicare rules is a qualifying event. Now, I have had other clients before though who have only 15 employees at their company or something less than 20. And in that case, you have to join Medicare. If your company does not have the 20 employees or more, you are required to be on at least Medicare Part A and B as your primary health insurance. Okay, so there's a bit of rules in there and differentiation, but there are ways to delay Medicare past 65. We have clients in their 70s joining Medicare for the first time because that's when they're retiring. Okay, so again, there's a few different factors to consider as to whether or not you should delay Medicare past 65. But that is a very common situation in which you would not have Medicare at 65. Now, I want to be clear about a few other things. First is retirement plans. Most retirement plans are not the same as employer plans. Most retirement plans do require you to have Medicare Part A and B as your primary health insurance, okay? So just because you have a plan through someone does not mean that it meets Medicare rules. And retirement plans are a really good example of that in which they do not meet Medicare rules. Again, you need to join Medicare A and B as your primary health insurance. I also hear questions a lot about Medicaid, right? If you're on Medicaid, are you required to be on Medicare? And the answer is usually yes as well. Most of the time, Medicaid wants you on Medicare and have Medicare be your primary health insurance. Now, with that said, if you were on Medicaid, it is so important to talk to your local Medicaid office to see what financial programs you qualify for. Some people on Medicaid will have their entire Medicare covered. They might also get extra programs like a special advantage plan to make your costs basically nothing, okay? But again, with Medicaid, you likely still have to be on Medicare. And the fourth one that I see happen a lot is marketplace plans, right? Or any sort of private health insurance. Please know that those private health insurance plans don't meet Medicare rules, and they're almost always more expensive than Medicare anyway, so it doesn't make sense. Now, if you have a subsidy through the government on that makes that marketplace plan very affordable, those oftentimes expire at 65. So double check with your state as to whether or not you can keep that subsidy. Otherwise, join Medicare. So my point is this. There are situations where you are not required to have Medicare. The situation that usually exists is when you have an employer health insurance plan which meets Medicare rules. I know that Medicare can be confusing, but it can also be simple if you follow us and follow our simple process. So again, if you found this helpful, give me a thumbs up. If you didn't, let me know as well. Again, I'm Emily with the Medicare Coach, helping you easily make your right decision and getting the most out of Medicare to protect your healthcare rights in your hard-earned retirement